Assalamu alaikum. Now we are going to talk about Norma Occipitalis. Norma Occipitalis is the posterior most part of the skull. It is formed by the two parietal bones above their posterior most parts, the squamous part of the occipital bone, and the mastoid part of the temporal bone. The two parietal bones have the sagittal suture between them, and the posterior most part is visible in this norma. The lambdoid suture, which is present between the parietal bone and the occipital bone, is also visible in this norma. Then, the parieto-mastoid suture, which is present between the parietal bones and the mastoid part of temporal bone, is visible, as well as the occipito-mastoid suture between the squamous part of the occipital bone and the mastoid part of temporal bone is also visible. Near the occipito-mastoid suture is the mastoid foramen, which provides passage for the emissary vein towards the sagittal sinus. The most prominent part is that this norma superiorly is convex backwards and inferiorly it is straight or flattened. At the junction of this convex part and the flat part is a prominence, this part here, and this prominence is called external occipital protuberance. If you can see, this is the prominence, and here this is the prominence. This external occipital protuberance provides a separation between the head and the neck in a human living person. Then, from both sides of the external occipital protuberance, there are two lines emerging. These are also protruding lines. These lines are called superior knuckle lines. These superior knuckle lines provide attachment to some muscles. 1 centimeter above these superior knuckle lines are highest knuckle lines. They can be or cannot be visible in the specimens. If we talk about the attachments on these knuckle ligaments or knuckle lines or the occipital protuberance, the upper part of the superior occipital protuberance gives origin to trapezius. The lower part gives attachment to the knuckle ligament, which is going to be present all over the posterior part of the cervical vertebrae. The medial part of the superior knuckle line gives origin to the trapezius muscle, and the lateral part gives attachment to sternocleidomastoid and splenius capitis. The highest knuckle lines, if present, give attachment to the epicranial aponeurosis and the occipital belly of the occipitofrontalis muscle. If these are absent, they are going to be joined to the superior knuckle line.